Department of Health and Human Services from the Governor's Commission on Alcohol and Other Drugs. Second. Any discussion? Okay, seeing none, all in favor of item 39, please signify by saying aye. Aye. Any opposed? The item is approved. I now ask for a motion to adopt agenda items 40 and 41 from the Department of Health and Human Services from the Division of Long-Term Support and Services. Long-Term Support and Services.
Second.
Any discussion? I think Councilor Stevens is looking at her notes. When you're ready, Councilor, take your time.
Commissioner, we're seeing a reduction in funding of 4%, or no, they're indicating that there's a 4% reduction of residents being served from July 1, 2020 to June 30th of 2021. So we're being hit with a reduction in funding. Is this accurate? Is this based, what is inhibiting access? Is it labor shortage? Is it COVID? I'm going to let
Anybody else in?
We're going to take a pause for the
It's
disturbance.
a public fucking hearing!
Go ahead, Councilor. Commissioner, I'm sorry.
Hi, I'm Nancy Rollins. I'm the Interim Director of the Division for Long-Term Services and Supports. Thank you for the question, Councilor. So, yes, we are seeing low utilization because of workforce struggles. Certainly in home health aid and a number of the other services in the community, we, like everyone else, are faced with a workforce shortage.
But the need is there, correct?
The need is absolutely there, and there are a number of things that are being done at the federal level as well as the state level in terms of bolstering our direct support workers.
No opportunity to renegotiate or...
Not with this particular grant. This is the Federal Social Services Block Grant, which was cut at the federal level. And really what this contract seeks to do is to renegotiate it down the utilization, which was low anyway, so it's just getting at the right numbers that will be served in these two contracts.
It doesn't seem to reflect the needs of our state. It's unfortunate.
Understood. Yeah, for sure.
Thank you.
Additional questions on either of these items? Okay, hearing none, all in favor signify, all in favor of items 40.1, to be clear, signify by saying aye.
Aye.
Any opposed? These items are approved. That concludes the Health and Human Services regular agenda items. We obviously have the two table items, 9B and 9D. I'll begin by asking for a motion to remove items 9B and 9D from the Department of Health and Human Services from the table.
Governor, I move we remove item 9B and 9D from the table.
Second. The motion is second. All in favor of removing the items from the table, please signify by saying aye.
Aye.
Any opposed? And those items are removed. I now ask for a motion to adopt agenda items 9B and 9D.
So moved.
There cannot be a discussion unless we have at least a second for discussion.
So moved. Second.
Okay, so we have a motion and a second. Obviously there's a lot of interest in these two items. I'm going to ask the Attorney General to come up and talk about a few different items, but for the record, just to be extremely clear, items 9B and 9D are a series of federal funds to the Department of Public Health Services. There's been some misinformation and discussion over the language within these contracts. As the Executive Council and my office requested, we did ask the Attorney General to clarify what some of this language meant. It is language that this Council has seen and approved before. It is language similar to other federal funds that have come into the state before. This is not the first time we've seen any of this language. So again, I guess I'll ask. I don't want you to read the entire letter per se, Mr. Attorney General, but to be clear, for the record, today the state has literally received billions of dollars in support from the federal government for management of the COVID-19 pandemic. So I guess the three summary items that you have here, Mr. Attorney General, and again, you can elaborate further if you'd like, what you provided to the Executive Council is the understanding that the language that appears, has been questioned, that is in question, it is language that has already been approved in previous contracts, correct?
Yes.
So this is nothing new. This is not a first time, and it's been done with money in terms of managing the pandemic.
Yes, that's correct.
And is it, and maybe this is more of a question for the commissioner, is it your understanding that it's likely that we'll see similar language in the future? There's no reason to think that this is going to be the last that we see of this.
Yes, we expect that.
And to be very clear, the language, again, if you can elaborate, that has been provided and that is in question, does not bind the state to any broader sweeping federal mandates. Is that correct?
Yes, that's correct.
So if the Biden administration were to put forth this OSHA mandate, this language doesn't force us to capitulate to that. It does not impede on our sovereignty as a state or impede on our ability to manage the COVID pandemic exactly as we see fit, as we've done for the past 18 months.
That's correct. It would not.
Okay.
Governor, can I ask a procedural question?
Sure.
Just so the Attorney General, if I may, just so I get it clear in my head how we're going to conduct business in the future. But, so end of last week, there was an understanding that the information that you were going to provide was attorney-client privilege information, and that this was information that was going to be brought before Governor and Council. So, I received something from the Governor's office, I think it was Thursday afternoon, saying, would I be okay to release the current client privilege information that you provided? Of course, I was totally wiped out the whole day on the road in meetings. And subsequently on Friday, I had a funeral to attend. So I really didn't get a chance to read your opinion until late Friday afternoon. So, but apparently this was released to the press, this information that you had provided for the Governor and Council. So I just wanted to know, as far as who had the releasing authority, and is it the Governor and Council that releases this? Or what context did you think that you were supposed to release this information, because I wasn't involved in it.
Sure. Yeah, so there's a couple things I think to explain there. The first, and to the extent there was a sort of a miscommunication on this, I do apologize. The first issue that we in our office were looking to clarify was whether the council ever intended this to be attorney-client privileged in the first place. I had an understanding when we discussed this item 2 weeks ago that you would want an opinion that would be available publicly. When we sent the council the memo, it became apparent to us that there was some potential disagreement on that, so we looked for clarification. I think different folks had different understandings, so that's why you would then ask if you would waive the privilege. That said, the Governor and Council is a unique body. The Governor and Council can act as the Governor and Council. The Governor can also act on his own. And so in this instance, the opinion was sent really to the Council. It was also sent just to the Governor. Because of that, the Governor had the ability to waive the attorney-client privilege. In addition to that, this was a unique circumstance in which this advice was being requested not just by the councilors, not just by the Governor. It was being requested by other state officials. It was being requested by individual members of the legislature and by officials who work for the legislature. Because of that, there is individual members of the legislature don't hold the same type of privilege with our office that the legislature as a body does, or the Governor as a state official does, or that the councilors do. Because of all of that, I made the determination that the Governor had the authority to waive the privilege as to the opinion that went directly to him, and that this opinion needed to be public. The Attorney General has the discretion at times to make an opinion public if there is enough public interest in the question of what the law means. So all those factors went into my conclusion to release the memo. But the Governor absolutely had the authority to waive the privilege as applied to him, and that's why the privilege was also waived.
No, okay, I see where you're going with this, but in the future, when the Governor Council asks questions, and you are our attorney, we don't have any other attorney that represents the council. I appreciate, somebody was trying to reach out, but that there would be at least a 3/5 majority on the council that says, yes, go ahead and release this information, we're good to go. And I'm sure the council wanted this information released. It wasn't the point. The point is, that in my years of state government, when there was a attorney-client privilege with a body, it was always that body that approved the release of it. So I think going forward, that would be very important to consider. The other thing too is that the way this was done, and I think it's probably more internally to your office, but there was an email of one of your staff was putting words into my mouth that was totally inaccurate, saying that we have checked in with 3 people on the council and implying that we've given our approval to the release of this information. And so we would have done it, but I just think going forward, we need to be crystal clear on you are legal counsel and what we release and what we don't. And obviously, we try to release everything because we're in a public seat. But we have a lot of attorney-client privilege issues out there that have not been released. And I understand that the importance and the timing of this information. But I just think that I kind of walked away with a sour taste because the media was calling me on Friday, and I said, I haven't even read it. I didn't know it was released.
To be very clear, Counselor, I asked my attorney, the Attorney General, for that opinion, and I do not need approval from the Executive Council to release the opinion that is directed to me. You guys can do what you want with it, legislators can do what they want with it, but I don't need 3/5 of a vote to decide what my office releases. That was my request. You had your request, I had my request.
So, Governor, I appreciate your comments, and you have that authority. I'll make a motion that we release the attorney-client privilege information that we asked the Attorney General to provide for us.
Okay.
Yeah, that's fine, because this is, I guess, the governor and council, as opposed to just the governor releasing the privilege. So it would be in order
Yeah, sure.
you're
If
okay.
the council wants to do that, that's absolutely fine.
I made a motion there, seconded.
Okay, all in favor of releasing the document per attorney-client privilege, say aye.
Aye.
Any opposed? Okay, the council has now officially released the document.
Thank you.
Sure. So a couple things, and then we can open up for questions. There is a lot of discussion about how these contracts would relate in any way to the private mandates from hospitals to their healthcare workers. Does approving or disapproving these contracts have any effect on the state's ability to manage any sort of mandates from the private hospitals?
No.
So whether these are voted up or down, that does not change whatsoever.
No.
In terms of the Biden administration's mandates, just to be clear, I've been repeatedly clear, I think you've been repeatedly clear, when these OSHA-driven rules come out, have we discussed implicitly that the state will sue the Biden administration over his attempts at federal mandates?
Yes, and we do plan to do that.
And do acceptance of this contract at all infringe on our sovereignty to push back on the federal mandates in that
No.
respect?
No, I do not believe so.
Commissioner, have you heard of any other states, Florida, Texas, Mississippi, Alabama, any other states rejecting this money for any reason whatsoever?
No, I haven't.
And is it your understanding that every state in the country has offered these same dollars?
Yes,
So we would be the only state in the country to reject these dollars?
based on my knowledge today, yes.
Okay. With that, I just want to make sure that the clarity of the Attorney General's statement and opinion in this office is out there. Again, accepting or rejecting these contracts has no bearing on what happens with private hospitals. Accepting or rejecting these contracts has no bearing whether we will, which we do, intend to sue the Biden administration over the potential OSHA mandate. They haven't written the rules. There are other governors across the country that will join us in that lawsuit, and we intend to join them as well. With that, we can open up for questions from the council. Council Warren.
So we've heard what rejecting these contracts does not affect or affects. Let's talk about what the effect of rejecting these contracts would be. Can you please explain what this money will be used for?
Sure. So 9B, we have
almost $1 million budgeted to go to contract for regional public health networks. So just a clarifying statement, this is just accepting the federal money. When we go out to contract for all of these dollars, those contracts will have to come back in front of the council for individual services. So you will have to approve the contracts that are awarded under these dollars if approved. So almost $1 million going to regional public health networks. This is what we expect. Like I said, we have not contracted yet. 3.7 we expect to go to bi-state into the FQHCs, the federally qualified healthcare facilities, to do vaccine delivery and vaccination of their community members. Under 9D, it's a variety of things. We have temporary staffing for vaccine operations, about $650,000, vaccine scheduling and administration, about $1.5 million. Medical direction to the public health network, so that is physician and nurse support to the regional public health networks to be able to run vaccine clinics. That's about $1.4 million. The IIS system, which is, this money goes to the hospitals to be able to connect to the IIS server. So this is money that goes to them, not necessarily to the department. And then, infection prevention services for the city of Manchester, the city of Nashua. That's the expectation of where these contracts are going to go if we accept this money.
Can you tell us about the negative outcomes if we do not accept this money?
A lot of our COVID vaccine response from a state response point of view depends on this money. So it doesn't mean that the vaccine is not going to be available, but it's going to be available through the healthcare system, which right now is struggling with staffing and struggling with their census. So in addition to taking care of people, a very high volume of healthcare patients, they're COVID patients, and having a decrease in staff, they will bear the brunt of needing to vaccinate everybody.
So is there another source of funding that you could use if we did not accept this money to provide these same services?
I don't know that.
Will this money be used to give booster shots to those who want them in our community?
Yes, the money that's allocated to go to the Regional Public Health Network would be used to do third dose boosters and also used to do some school-based clinics for kids. When that's approved, it's a variety of different uses.
So we heard earlier that 70% of Granite Staters have chosen to be vaccinated. If we don't accept this money, we will make it more difficult at a minimum for those people to receive their booster shots. Is that right?
That is correct.
And why is it so important to get as many vaccinated as possible?
To reduce the transmission risk, the community transmission, and to prevent serious illness and hospitalization and death for some people, specifically those that are elderly and infirmed in our state.
And will vaccinating also allow our schools and our businesses to continue to run?
Absolutely.
So turning down this vaccination or this money really denies most Granite Staters who want them access to vaccinations.
It denies them easy access to the vaccination. They would likely be able to get access through a primary care office, but those primary care offices would be inundated and not be able to provide health care and vaccination efforts together. I think one of the issues that we hear a lot around this issue is I'm not going to get COVID and I'm not going to go to the hospital, or I won't need to access physician services. But the reality is that whether you have COVID or not, your ability to access healthcare services in any state right now across the nation is impacted, because if you have a heart attack or a stroke, you need that same ICU bed as someone that has COVID. So increased COVID rates and increased hospitalization rates, increased rates of serious illness impacts everybody's ability to access good quality, safe health care.
Is there anything in any of these contracts that you will be entering into that will force someone to receive a vaccine if they do not want one?
No.
Thank you.
Further discussion?
Yes, go ahead.
Councilor Wheeler?
Thank you, Governor. Between those who have vaccinations and those who have natural immunity from COVID, what is the size of the pool of the people that are left?
We don't know that.
You don't know that. Then how do you know how much money it is?
We know what it's going to cost to give accessibility to everybody in the state, but not everybody that has had COVID has had a positive test for COVID. Some people, especially early on in the pandemic, where we didn't have the ability to test everybody, we told people with mild illness, stay home, self-isolate, do those things. So we have no way of knowing without doing full spectrum antibody testing on everybody in our state how many people have natural immunity or vaccine immunity for COVID.
So every night on the TV, there's numbers. So many people have COVID in New Hampshire. You don't keep track of those numbers to know who has COVID and who doesn't?
Of course, yes, we keep track of how many people have had COVID in New Hampshire.
So what is that number?
Approximately 125,000.
Yeah,
So of the 125,000, how many of those are vaccinated and how many have natural immunity?
we have a percentage of breakthrough infections that I can get you those exact numbers. For people that are vaccinated and go on to get a COVID infection, typically what you see is a milder infection when you have a breakthrough infection. But I don't have the exact number of how many breakthrough cases we've had for vaccinated people with me here.
And if I may, nor do we pick up the phone and call all 125,000 people and ask them if they're getting the vaccine. If that's what you're implying, that would be wrong.
That's wrong, but collecting the names mandatorily of those who are vaccinated is not just as wrong?
There's a law, sir. There is a law in the state of New Hampshire that we have to comply with, a law that all 49 states, Florida, Texas, Mississippi, Alabama, South Dakota, every one of those states has a vaccine registry, and no one in those states is saying it's a violation of their civil rights in any way. So every single state, every conservative state and liberal state has that. We have a law that requires us to do that. If the legislature wants to change that law, that is up to the legislature, of course. But the commissioner and her department are following through with the law, as they have to, by law.
I'm very familiar with the registry. I was chairman of the Senate Health and Human Services Committee in 1998 and fought the mandatory registry then. There should be a will, and I think we're not hearing the people. They don't want a mandatory registry. They don't want their private health information going to the government. And they have that right not to have that happen. And we ought to be advocating for that and not just turning and blaming the legislature or kicking the can to another group of people. And we should not be funding these items until we get a registry that is voluntary. And until we track and know the facts. We talk about science all the time, but we ignore the fact that people have natural immunity from already having COVID. We ignore it so much we don't even want to keep track of it. That's just wrong. And then handing out millions of dollars and not doing it the right way. I just can't support this article, this item.
Again, if you have just said you want to track everyone that has COVID, no. That is not what the state is going to do, because many thousands of people potentially had COVID and were never even tested for it. So the only way to do that is to start picking up the phone and going door to door. The state is not doing that, sir.
I didn't ask for their names.
You said we should track it.
You should track how many COVID cases you have so you know what reality is. You have a rough idea of how many people have natural immunity.
We have 125,000 people, many of which have gotten this vaccine, some of which haven't. We don't keep track of that.
The only way to track the people that have natural antibodies is to do an antibody test on each person in the state.
We don't even make that option available before we tell them they're going to lose the job. People out there are angry, and rightfully so.
The state government is telling no one to lose their job. The state government has no state-driven mandate.
Then
And that is
like
misinformation. You can't be...
Will you stand up like the governor of Texas and tell private business they can't fire people?
You want the government to tell private businesses who to hire and fire. That isn't even socialist. That is completely un-American, sir. Because when does it stop? You have to hire this person, you have to fire that person when they're not a protected class. We have laws for that. And so now, I ran a business, I had 800 employees. I can't imagine if the state came in and told me who I had to hire and fire. That's un-American, frankly. Those are private businesses. The state government has no mandated vaccine. We don't mandate it for our employees. We don't mandate it for our entities at all. That is pure misinformation. So I'm going to push back on that every time.
I will just respectfully disagree, Governor.
You disagree with the law of the state?
I disagree that we should not be stepping out and saying it's wrong to fire people if they don't take the
We might not agree
vaccination.
with it, but let's be clear. Councilor Wheeler's position is the government should determine who is hired and fired by private businesses.
My position is that these people are protected by the Constitution.
For a job, the Constitution does not protect people, demand that government provide a job for everyone. That is not a constitutional protection. And a private business there are certain laws that say under a protected class you cannot fire certain people for certain reasons. Vaccination is not one of them. At all. It has never been for 100 years.
Thank you for putting that on the table.
So, Governor, just to follow up on that, when someone doesn't get vaccinated at a place of employment and they lose their job, they're dismissed, which we know that's happened quite a bit across New Hampshire. At that point, they're ineligible to apply or to receive unemployment benefits because they've been dismissed because they weren't vaccinated. Isn't that the government telling that that particular private entity or that business that you can't get, that employee can no longer get unemployment benefits at this point?
No, that has been the law of the land, and that has been the situation because businesses have retained the right to ask for a vaccination for decades. And that has been the law within unemployment. So everyone wants to go back to back to pre-COVID ways. This is the law that has been on the books for ages. If you're saying that the legislature should go and change the law just because of COVID, or I should institute a state of emergency again, we're not going to do that. So this has been the law for decades. Why would we change it now?
Well, the only time I've ever been required in my life to be vaccinated is when I joined the U.S. military. Unless you give up your rights when you join the military, at least a good portion of them. But I was never asked to be vaccinated in any other type of employment that I've had here in the state of New Hampshire. Obviously, we're living in very unique times. It's very difficult for everyone. But the legislature really needs to get it going and start fixing these things because the state that was lacking an employment workforce prior to the pandemic is surely losing out even more upon the employment workforce in New Hampshire because they're frankly saying, we've had enough, we're not going to go and work because we're not going to abide by the vaccine mandate. And suddenly, the ones that were in healthcare are now trying to be correctional officers because they don't require a vaccine. We've got a workforce crisis in this state, and we have to be a little bit sympathetic to the people who work hard in the state in making sure that we can provide some type of compromising solution that people can move forward with their daily lives and have a job and to provide for their families.
Let's be very clear. We don't want a single nurse, a single doctor to have to leave. We don't, and that is not something the government has a say on. These are private hospitals. The government cannot tell a private hospital, they're not government-run hospitals. If the government-run hospital, they have in New Hampshire Hospital, there's no vaccine mandate there. But private entities, you want the government to force them to hire and fire people. And by the way, if I may, Commissioner, have vaccine mandates been in place with private hospitals and healthcare institutions prior to the COVID pandemic?
Yes, as a registered nurse, I've been required to be vaccinated on measles, mumps, rubella, hepatitis, tetanus, influenza.
And if I may, are all of those individuals told about the potential requirement upon employment?
Yes,
And
you're
they
either
accept that.
required to show your evidence of vaccination of all of those things or get titers done to see if your antibody levels are high enough to protect yourself, your peers, and your patients.
We don't want to see anyone have to leave healthcare. We absolutely have a workforce crunch. But one of the most important roles of an executive is to know the limits of their overreach, which is exactly why we will sue Joe Biden, because he is changing rules, overreaching his limits as an executive, and infringing upon the state's rights as it pertains to the OSHA mandate. But to say that as a governor, because I don't want a nurse to be fired, that I should just with the sweep of a pen change all the rules around and potentially create massive problems down the road. As soon as you open Pandora's box for the government telling a business who they can hire and fire, you can imagine what will happen when someone else is sitting here, or the next governor, or the next governor, or the next governor. That Pandora's box can never be closed. And now government is telling businesses how to run their business. That isn't even socialism. That's actually pure communism.
Well, I
So
wasn't
let's
talking
be very
about
careful
how
about what
business
you're
was
implying.
wanting to run its business and what to tell its employees. I was strictly talking about unemployment compensation. Now, when we talk about the vaccines that nurses are required to receive, that's not based off of emergency use authorization. That's something that is a standard vaccine that's well known and that has been field tested for many, many, many years. This is something that is highly experimental. It's not FDA approved.
Yes, it is.
It is
Pfizer is FDA approved. That
Absolutely,
is
it's FDA
misinformation.
But you're telling me that all the vaccines that are out there to offset COVID has been approved?
But Pfizer's approved, and they have every ability to get the Pfizer vaccine. There's no lack of that. So they have every ability to get a fully approved vaccine. No one is prohibited from that, if that's their choice. If they say, I don't want an experimental vaccine, then they can go to the fully FDA approved one and get that too. Which is why no healthcare facilities required the COVID vaccine while it was in emergency use.
That's just wrong. What, are you hiding under a rock?
Again, that's a disturbance. We're gonna
There's
have to
already people losing their jobs. Are you hiding in a cave? It's already happening. You're lying up there. It's the state of New Hampshire. I don't care about the other states. We're a nice state. We can be different. We can set this the way that other states go, not the other way around.
We'll continue. Dr. Stevens, do you have a question?
Commissioner, the regional public health networks, there are 13 within the state. These health networks are poised to assist with implementing the proposed services within 9BD. What other services do these regional networks provide? We know that they are dependent on $1 million in funding, as well as the cities of Manchester and Nashua are depending on $120,000 for vaccinations for children who have lagged in receiving them due to COVID. So what other services are they providing?
I mean, our regional public health networks are like the spokes of our overall state public health network. They provide flu clinics. Right now, they are very busy providing flu clinics to both kids and adults. It's one of the things they do. Our bigger, well-organized public health networks like Manchester and Nashua, they have a more robust programming where they're doing population health, community health, immigrant refugee health, really focusing in on different communities that live in poverty and trying to change the outcomes for those people. So they're really, it depends on how much funding they have and what part of the state, but they're really the branches of our public health strategy across our state to reach vulnerable people.
Thank you. Follow-up. Staffing issues at DHHS. Data is showing that in some of your departments, you're down. There's a shortage of sometimes 30 to 40%. Across the state, 20% is the average, and we know that 9% is acceptable. We're seeing an increase in dependence on providers, personnel with our contracts.
Nothing approved!
Could you add to that?
Sure. So during COVID, when we were unsure of what our finances were going to be at DHHS and the state overall, we went into a hiring freeze for 8 or 9 months. So automatically coming out of that hiring freeze, we were down below where we typically were when it comes to vacancies. We've done a variety of things around recruitment. You'll see we have an RFP that was released last week. That's not just for DHHS, it's for all healthcare workforce across the state. You'll see hopefully see a contract coming before this council in the coming months around recruiting healthcare workforce for the state of New Hampshire, every provider, hospitals, nursing homes, home care, direct service providers for people with disabilities, everybody. So we are doing that recruitment. We are trying to support our colleges and our community colleges and our universities and getting their nursing programs up, providing preceptor sites, all of those internship programs. We're doing all of that, I think, but we're in the same place as what the healthcare workforce is like across the state right now.
Thank you. In regards to the funding of $27 million, do you foresee the state using all of those dollars? Do you think it's appropriate or excessive?
Oh, it's definitely not excessive. I do see us using all of those dollars to provide accessibility to vaccines for the people that want them.
Our nursing homes are now turning out to be our fragile sector. We've gone from daycares to nursing homes. Staffing is a big problem. Now we're seeing long-term care. Facilities are up for sale, and it may be solely for the real estate. They may not continue as long-term care facilities.
Nursing homes have probably been the industry hardest hit throughout this pandemic, both when it comes to COVID numbers, loss of staff, loss of residents, all of those things. I think they have been by far the hardest hit industry. I think there was some relief over the summer. We saw our outbreaks go down in nursing homes, like the number of deaths in nursing homes go down. We're starting to see that creep back up a little bit. Not at the levels it was pre-vaccine at all, but we are starting to see some breakthrough infections in long-term care, which makes sense because it's been 9 to 10 months, which is why we are giving that third dose. And we're making that the priority population in our state to give that third dose. The people over 65, the healthcare workforce, EMTs, fire, police, all of those people really prioritized because they were early on in the vaccine program where they were in 1A, 1B, and now we're ready for boosters, and we want to keep those rates down.
Thank you.
Further discussion? I'm going to go to Council Wellington, and I'll come to you, Council.
Okay.
So just to be clear, we've heard a lot of talk today about issues that really don't relate to the money that we're talking about here. We cannot forget that this is truly a public health question. And rejecting these funds would impede people who want to get the vaccine or boosters to readily access them. It would place additional burdens on our already stressed healthcare system and our healthcare workers. It would delay our recovery from this pandemic, and it would prevent the full recovery of our businesses and our schools, and we would fall behind our neighboring states in recovering both economically and from a public health perspective. Is that right?
That is correct.
Thank you.
Council Kennedy?
No, thank you. I just want to clarify a statement I made earlier. So the emergency use authorization was approved by FDA. But I do want to point out, we just gave you $2 million, correct, for the mobile clinics for COVID vaccinations?
Yes.
Okay. I just want to make sure. And we are giving you $11 million for long-term care in an upcoming contract for our nursing homes around the state. Is that correct?
It's not for vaccination, but that is to enhance their staffing and...
I just heard about employment issues in the nursing homes.
Yes.
So we are giving you $11 million.
Yes.
Right?
Yes.
Okay. I did have a question to the Attorney General in regards to the opinion, and I think it really has to do with the last portion of it, the third item. And I really need to get a clarification on this because you mentioned it's limited to quarantine isolation. This also does not have an apparent overlap to announce the vaccine mandates. There have not been yet been any quarantine or isolation orders from the federal government related to COVID-19. What did you mean by this does not have, quote, an apparent overlap? The word apparent is kind of, it's an operative word, so can you kind of explain that?
Yeah, you mean an apparent overlap with announced vaccine mandates from the administration?
Okay.
I think apparent probably doesn't, the apparent doesn't even need to be in there. There is no overlap between potential quarantine or isolation orders and what the administration has announced they're intending to do with, for instance, the OSHA, the new vaccine mandate for employers, 100 employees or more.
And currently the CDC has not recommended any isolation or any type of quarantine for
They have not mandated anything, no.
but they do have the capability under this contract.
I would take the position no. I mean, the contract references potential federal isolation or quarantine orders, but I do not believe that that language would require the state to enforce orders like that.
Nor would the state enforce any order like that,
Okay.
ever.
Yeah, and the question of whether we would, frankly, would ultimately be decided by me, and we would never do that as the chief law enforcement officer.
Okay. Thank you.
Further discussion?
Governor, I have a couple more questions, maybe for you or maybe for the AG. I'm not sure which is which. But do you think the new constitutional amendment, right to privacy, that we passed just a few years back, would change whether the vaccination registry can be mandatory? Because it's essentially mandatory, even if you can opt out. It's so many obstacles to opt out, you really can't. So do you think that constitutional amendment gives the people, you know, the right to have a real opt-out registry?
I really can't comment on that, Counselor, for a couple of reasons. One, I haven't reviewed the question, but second, as Attorney General, I have an obligation to defend the laws that the state passes, so I can't comment here publicly on whether I think there may be a potential challenge to a state law.
And then could you tell me which items you stated that have the exact string, federal string, regarding that we will support the implementation and enforcement of federal orders related to quarantine and isolation? How many items have we passed with that language?
There are three.
With quarantine and isolation?
Yep, there are three items that the council has approved that has that language.
Do you know which ones they are?
Yep, so item 19 on August 18th,
Yep.
and items 9A and 9C from September 15th. August 18th was an item involving over $22 million. That item was also approved by the fiscal committee, so that's a fully approved item with that language.
19, 9A, and 9B?
So item 19 from the August 18th Governor and Council
Okay.
meeting, and then items 9A and 9C from the September 15th Governor.
And this is 9B, so that's only two. The tabled item is 9B.
9B and 9D,
Yeah.
yeah,
So there's two that have been previously snuck through.
approved, yeah.
Yeah. Okay.
You received the contracts, you voted for the contracts. This council voted, nothing was snuck through. This council had an open and public debate on those contracts. You accepted that language with no problems before. I just want to be very clear.
I guess my next question is for the governor. When the legislature convenes, will you support moving to a truly voluntary vaccination registry?
Meaning what? Meaning an opt-in, not an opt-out or something?
That's correct.
We can look at that, absolutely. We can absolutely look at that. I'm not going to commit to a piece of legislation that doesn't exist, but of course that's always on the table.
Thank you, Governor.
This question, Mr. Attorney General,
Yeah.
having already accepted and approved items that have this language, we are already bound to this language, and therefore rejecting the language in this contract would have no effect, is that right?
Yeah, to the extent there are any consequences of that language, which, if there are any, I think they're very narrow, we would already be bound to them. But just to make clear, I do not believe there are consequences that would require us to comply with law, directives and guidance.
Okay. Clarification? Sure. If we were bound to those, it would only be for the amount of money in those contracts, not this one, unless we pass this one. Is that correct? To return the money if we didn't?
Correct. Yeah, to the extent there are conditions, you can eliminate them by returning the money, so that is correct. It's only that amount of money that we have to return.
Further discussion? Councilor Getz.
Thank you, Governor. I wish the council will humor me by telling me on item 22 that we just voted and passed on, Councilor Kennedy said 2 million, no, we approved 13 million.
About $2 million on top of 13, for a total of 15.
Correct. That amount of money is going for what? Can somebody humor me?
I don't have the agenda in front of me, so
To approve mobile COVID-19 vaccinations to individuals as requested by the department by exercising a renewal option by increasing the price by 13 million.
yes.
So when you said the 27 million wasn't enough, this looks like it's 40 million.
With that, when you add that contract in.
Right, but if they can do it for 13,
They're doing a piece of it for 13, they're not doing all of it
that
for
was never
13.
stated when we asked for the testimony.
We have so many providers providing vaccination in this state. I could list them. There's over 550 people providing vaccine in this state right now. And that is one contract of many to do vaccination programs.
Well, I don't believe we've got to spend another 27 million on things that we're spending money on already. I think that's wrong. Just because it's federal money and free, it's never free.
Those dollars are taxpayer dollars of the state of New Hampshire.
You're right.
Nothing is free. These are these citizens' dollars coming
You're right.
back to the state. If they are rejected, they're just going to go to another state.
How many more times do we have to re-spend the same dollars for the same thing?
It's not the same thing. It's an evolving program.
Well, it depends on, I guess, whether we're prepaying something or they're billing us.
No, it doesn't depend on that at all, actually.
All right, thank you, Governor. I'm done.
But let's be very clear, we haven't spent 40 million on this. We've spent well over $100 million on this. This has been going on for 18 months. This is not a new program or a new subject, especially around vaccines. This has been going on long before this contract has, and a lot of the dollars have come. These are the citizens' dollars of the state of New Hampshire. This isn't the government's money. This isn't, we gave you money. So just to be clear, I guess I would look to the Attorney General. In 18 months, with the billions of dollars that this state has taken and used our taxpayer dollars to manage the COVID pandemic, from their testing to vaccines to everything else. As far as you know, has the state ever capitulated to some overriding mandate of the federal government?
No.
Ever?
No.
Never. So let me be very clear. We have never done it. I will never do it. Not under the state of emergency. Not now. So to say that there's some sort of precedent here is 100% false. To say there's some sort of precedent of us capitulating to this administration or even the previous administration. There were potential mandates coming from the previous administration that we said, absolutely not. We do it our way. And you know what the result is? The best managed state in the country when it comes to the economy, flexibility, and the safety of our citizens when it comes to COVID. It is not an accident this state has the lowest hospitalization rate in the country. It is not an accident that we have the lowest unemployment rate. It is not an accident that we are the #1 state on the East Coast to move your business and your family to. That's because we manage it our way, every time. So I want to be very clear. If there's any insinuation that we ever have or ever will, under my administration, capitulate to anything from the federal government, in fact, I'm known for it. I've got a great reputation for it. We do it our way every single time. If there was history here, I would get it. If there was precedent of me capitulating to the Trump administration or the Biden administration or the CDC, I'd get it. We don't follow all the CDC rules and regulations because they don't always apply to us. We believe in local control, and we support that 110%. There are limits to the executive branch of government having sweeping authority, and that is a realization I wake up with every day, and a responsibility I carry every day, and never once has that been abused. We do it the state's way. So I just want to be very clear. We never have, we never will. So I appreciate you have reservations, but they're based on fantasy.
Well, they're not fantasy, Governor, because people are being laid off left and right.
That's not what the government's doing.
Well, the government might want to make a statement to the private sector and say whether they can do it or not do it, but simply say, hey, you know...
We just did. We just had a whole discussion on it, sir. I've been very clear. I'm very concerned with every one of our healthcare workers that might get laid off. We don't have a mandate with our hospital. We create that
What
flexibility.
I'm concerned about is we have people that, we have all the other crises that we tend to overlook, like the opioid crisis, the employment crisis, the shortages and the supply chain, that affects all states. But we have other crises in the state. And I'm concerned about the employment crisis, because where I represent, the travel and tourism has been decimated, okay, when it comes to employees. When I look at healthcare, it's decimated. And the more restrictions we put on an employee, the less that they're going to want to...
We put no restrictions on employees. You just said we don't put any restrictions on employees. Again, that is a complete misinformation and a falsehood. Just the opposite. It would be a restriction, it would be a restriction on an employee if I told Fred's Flower Shop that he had to keep all 4 of his employees hired, regardless of whether they're vaccinated or not. That is his flower shop, that is his right to manage his business, that is his individual liberty. And now you want the government to infringe on that individual liberty, we won't do it.
It's the individual liberty of this state to say goodbye to its employees, because I've had 16 just lay off the north.
We don't have state employees being laid off. The hospital employees are not our employees, and if they want to take that up with the hospitals, they have every right to do so. Of course,
They are our employees in the sense that they live and work here in the state.
as does every business. So are we going to mandate that for every
You
business?
say private sector versus public sector. The public sector shouldn't tell the private sector what to do. I totally agree with that.
No, you don't. You're saying the opposite. You're telling me that I need to tell a private hospital how to run their business. Right? You're telling me you can't fire Sarah. You have to keep her
I'm
hired.
telling you that essential services of the state are going away because people are being laid off.
And you think the answer is government, and I don't. I think the private sector has the individual right to manage themselves. That is capitalism. That is America. Not big government telling everybody what to do. You can't say the Biden administration is forcing a mandate here and we have to stop it, but the state government should institute a mandate here and force it to stop the way we want it. You cannot have it. Those are two sides of the same coin. You can't have it both ways.
What I'm simply saying is that the private sector is losing its employees.
And you want government to fix it? Yes or
We're
no?
all in this state together. We're all in the same sandbox here in New Hampshire.
Sure.
We're all, when those people leave and they go elsewhere, we lose them because
I couldn't agree more. I could not agree more. That is a very scary proposition for our entire healthcare system. If your proposal is government needs to fix that, that's a whole different system of government, sir.
Well, I would
Appreciate
say
the passion.
that.
I join you in the sentiment.
Well,
but the limits of government are
we
clear.
pass resolutions, of the effect of law. We send messages to our private sector and say, listen, let's find a way. Let's work together to hang on to our state and,
I've been on the phone with all those CEOs of all those hospitals. We've had the discussions. I've talked
It's
to them
just
directly.
not hospitals. It's everywhere. People are just getting laid off left and right or leaving their jobs.
I completely agree. I think that the rate of people quitting their jobs is at an all-time high. It's very scary.
We're like the second oldest state in the country. We're losing our young people on different fronts, and for some people, it's just another front.
Look, I'm just going to be very clear. I think what we disagree on is the government has limitations in terms of what it can mandate a private entity to do, whether it's a hospital or Fred's Flower Shop. There are limitations there. And I know we all want the end result, but just sometimes the ends don't justify the means. And the means of fundamentally changing our American process and infringing on individual liberties of those business owners is wrong.
I don't disagree that private sector needs to do what they need to do, but we as leaders need to encourage them to come up with better solutions so we can hang on to our workforce.
Okay.
Encouraging them does not include voting down this funding. This funding has nothing to do with that, and a vote against this funding is guided by politics and not by public health of the people of our state. More than 70% of our people have been vaccinated. They want to be vaccinated. And we're going to take that away from them. And the irony of counselors at this table arguing that the federal government should tell private business what to do is just irreconcilable. This is you listening to a very small, misinformed minority. The vast number of people in this state want this vaccine, and we are here to deliver it. We are not here to say no to them. This is a public health crisis, and if you want to know how to get back to our booming economy and how to have people working, there are people staying home because they don't have anyone to take care of their children during a pandemic because schools closed. They have people who are afraid to come back into the workforce because they don't want to be exposed to the virus. If you want to restore our economy, put the pandemic behind us. That's what we need to be doing.
Well, I would disagree because 100% of the people here in New Hampshire do not want to be vaccinated, as you just suggested. People want to opt in or opt out.
That is not what I suggested. People can make their own choices. But most of the people in the state of New Hampshire have chosen to be vaccinated. That's a fact. You can't argue with that. This is what the people want. This is what the people need. This is what we need to do to move on again from this pandemic.
Okay. Any questions? Can we go to a vote?
Listening to all this overnight, I just voted the $13 million. to fight the pandemic. And when people want to say that I'm not supporting it, that's just not true.
$13 million isn't enough.
There's
It's
more
not even
coming.
close.
Counselor, there's more coming.
With the same
There's more
language that
coming.
you have.
This one,
So you can turn
22
this
have
one
that
down.
stipulation.
So you can turn this down for political reasons and fill in the gap somewhere else. It's
I'm asking a
cowardice.
question.
It's
Does
cowardice.
item 22 have that stipulation?
Oh, no, I don't think it did. No, not at all. Yes, some do.
So if it didn't, then why do some of them have it and some of them don't?
Go ask the Biden administration.
I don't want to ask anybody.
But that's their language, not ours.
I respect your personal philosophy, that you aren't going to let this happen in the state of New Hampshire, and I applaud you for that. That's why I voted for you. Because you're a single thinker, and you think for the people in the state of New Hampshire. But again, you can't sit here and say, I don't support the COVID vaccine, because I just voted for member item 22. $13 million, half of what is being asked for on the table.
Okay.
And I'm sure that the department will find another way to bring it forward to this council as they have done on other items today.
I certainly will.
I'm sure you will. And that's okay.
Okay. All in favor, let's do a roll call on each of the individual items, just so it's very clear. If you'll take a roll call vote on item 9B.
Yes.
I'll put the United statement to make.
No, you can't.
Okay.
Sorry, I can't do that.
We're in the voting.
Sorry. Okay, we'll take, just to be respectful, let's take a pause and vote if you want to.
I think we're all in agreement with a significant portion of the goals within the CDC grant guidance document, COVID-19 Vaccination Supplement, April of 2021, especially health equity. However, language within the terms and conditions of the two federal grant awards is not fully supported by all council members and has raised concerns with my constituents and residents in New Hampshire. But we cannot afford to ignore or overlook the critical needs of New Hampshire residents at greatest risk from COVID. We need to take ownership of solving this issue and take care of New Hampshire residents on our terms. We cannot allow unresolved concerns impede access to much-needed care. No one has talked about the equity that these two grants are supposed to address. It's supposed to launch out and take care of people living in rural communities. Rural deaths continue to be higher on average. People with disabilities, people who are underinsured or uninsured, people who are homebound or isolated, people with transportation limits, critical populations with increased risk for infection, severe illness, and death. We cannot overlook our senior citizens, their risk factors, their needs for boosters. And Commissioner Chevenet will attest to this. In the early stages of the pandemic, I had countless, dozens and dozens of calls from my constituents, my senior citizens, who desperately wanted to get the vaccine, yet were having trouble gaining access. And we addressed those fears, and those fears were legitimate. I've spoken with families with developmentally and physically disabled children. They're fearful. I've also been inundated with constituents who are frightened that their civil liberties are at risk. Through the equity branch, Commissioner Chevenet and DHHS have developed a work plan to address and improve access for those at increased risk, which includes partnering with the 13 regional public health networks. Furthermore, within the New Hampshire Recovery Plan Fiscal Recovery Fund's 2021 report, promoting equitable outcomes is included, along with 11 public health categories that would address the needs of those at greatest risk. At this time, there is so much fear and disinformation. I would like New Hampshire to take control of this with the thought that this is one time. The goal is not to establish precedent, but to address the disinformation and fear. I'm confident that we can accomplish these goals without use of the $27 million at this time with the CDC mandates. Alternative funding to consider. DHHS, their COVID immunization supplemental funds, more than $10.6 million has rolled over into state fiscal year 22. We know that $8 million has been used, but a lot of that is overlap for the goals we're trying to achieve. We also have to consider the appropriation of $28 million today in the form of 6 contracts before the council, in the form of supplemental appropriations, public assistance from FEMA and Gopher. We also know that there's our state fiscal recovery funds. Based on approved public health expenditures, we need to take that into consideration. We also need to consider the $35 million that remains in CARES funding. And we can't forget our regional public health networks. These are the safety nets within New Hampshire that our residents depend upon. I think we need to communicate this, alleviate fears, stop the frightening, fictional banter that's out there. But at this time, I think we have alternatives for funding right in front of us that we can use as we address the disinformation and fear.
And with that, we'll go to a roll call. Well, let's redo the whole roll call, if you don't mind. On item 90.
No.
Yes.
No, with this.
No.
No.
So with that, item 90 is rejected. Can we do a roll call on item 90?
No.
Yes.
No, based on my statement.
No.
No.
And with that, item D is rejected. And that concludes the... a lot more business to attend.
That's what people want.
So moving on, we have item D. I've asked for motions up for item 42 and 44J from the Department of Transportation. Can I get a motion?
Thank you for listening to we the people.
42 through 44J from the Department of Transportation.
Thank you.
I'll make a motion to accept.
We the people.
Is there a second?
That's blue.
Yep, sure. Yep, we'll take a motion in a second before the minutes go to the final contract. So, any questions on items 42 through 44J?
We the people have spoken.
Councilman, can you read the question? Sorry. Commissioner? Yes, we do have a question. Come on up, thank you.
I do have a question, but it's off agenda. We had the flooding incident in western New Hampshire, Cheshire, and Sullivan County in the end of July. Many of our towns, Acworth in particular, is really heavily damaged. There's still issues related to providing access to people's homes, for fire and safety access, for businesses to have goods and services transported to and from. And I would like to hear an update on what we are doing or can do to make sure that we get some funding to these towns right away so that they can address this issue before the winter. Specifically in Acworth, they have an estimated $26 million worth of damages, even with the FEMA money that's going to leave a huge gap. But the FEMA money isn't here yet. And we have winter in New Hampshire, and we don't have much time. And these cities and towns need funding. Can you tell me what, if anything, is being done to address that need?
I do apologize, Counselor. I'm not as fluent on that. I know a lot of the aid and the discussions are going on with HSEM. I know there was a public meeting this week, and I know there's some other public meetings to discuss what can happen, and there have been some discussions about different RFAs that support, state loans to these towns, I think, but I'm not as fluid on that. I can speak to our facilities, the state facilities that have been impacted and that we're working on repairing. I've seen the estimates from AFWORK, and I've seen the information coming from those meetings, but I don't honestly know what other efforts in the state are going forward to provide them assistance.
Can you address the state road in Charlestown and in Alston?
Yes, I can speak well on those. So we have been working on Charlestown to get the contract prepared. There's been a lot of coordination back and forth with the railroad. The road is actually in the railroad's right-of-way. The railroad takes precedent because it was there before the road. So everything that we're doing needs to be run through and needs to be approved by the railroad. We've had good coordination. We just got the final set of plans that we intended to bid to the railroad. We're hopeful to hear from them this week and have a turnaround. And as soon as we get that approval, we will advertise the contract to repair Route 12. The funding with that is still a little uncertain. We are pursuing emergency relief funds. That road was damaged at the end of the storm, or technically in the August 1st storm, so the presidential declaration it only included January 29th to 30th, July, excuse me, thank you. But I think we are appealing that. If that's unsuccessful, we would pursue conventional, regular federal funds that would be at the expense of some other roadway work, but that's our plan to fund that. And
Are we going to have that road open before the winter?
it won't be open before the winter, but we've pledged to work through the winter continuously and get it open as soon as possible. Our current time frame has been looking at probably sometime in February. We're anxious to get a contractor on board because their means and methods and production rates and some of the incentives we have there would really get a more definitive schedule and time frame for that.
And Alston?
In Alsted, we have opened that road to alternating one-way traffic. It's going to remain that way through the winter with signals in place. We are working through some design options and some design alternatives. Again, that 123A in Alsted is not federal highway aid eligible. We would be pursuing FEMA reimbursement for those funds. But we are working through some options. There's some feeling that putting the road right back just as it was wouldn't be the smartest choice, so we're looking at some other improvements too. And that gets involved with some of the hydraulics around the dam to hopefully prevent future impacts. So that's taking a little bit longer because of the design alternatives. It's going to be as it is. It hasn't been paved in. We're going to pave it for the winter. It's going to remain alternating with traffic under signal control through the winter. And we should have a contract and a project next construction season to replace that section.
And Governor, I understand that there is some funding that can be approved by Governor and Council as gap funding under various statutes, and I understand that Senator Guider and Senator Prentice are approaching your office about it, and I would just urge you to do whatever you can to make sure we can get these roads fixed before the winter.
No, completely agreed. I think that one of the concerns is that right now all of the estimated amounts are based on a single contractor, if I understand. So it's really unclear how much will ultimately be approved and therefore how much risk there would be. So I think that's what the legislature is looking at in terms of their approach to what could or could not be funded in terms of the the risk that the state would have to take.
Yeah, understood. And I was at a meeting last week where the Commissioner of Transportation agreed that the transportation employees would be available to help in verifying that funding. And I can just say time is of the essence. Really, we need these roads opened, a temporary fix at least by the winter.
I completely agree. Thank you.
So, Governor, on that thought, when is the next legislative session? Is there a veto day, and is there going to be ability to introduce any legislation?
You'd have to ask the speaker. I don't know when they have a veto day or anything like that.
Okay.
I'm not sure.
Because traditionally, when it has been emergencies in the past, usually around the May or June flood season, that then during veto day, legislation has been.
I believe they could take it for fiscal, potentially. I think fiscal could even do it before veto day. So they could take it up earlier.
Okay.
Yeah.
Okay, thank you.
I believe. Yeah, Councilor Cassidy.
Thank you, Governor. What you would see in that has to do with exit 4A. And my understanding is that the House killed a bill that would have funded 4A legislatively. You know anything about it?
I'm not sure what you're referring to. The House recently or last?
2 weeks ago.
Well, there's no bill on the House.
The House is in session.
Was it something to the fiscal committee maybe?
No, it was an actual committee meeting, but they voted it down. And the rumor spread around the room was there's not enough funding to finish exit 4A. I want a clarification in writing from you and the commissioner that there is funding to pay for exit 4A. Please.
Sure. I think we've said that verbally.
I know
and
you've said
I
it.
put it in writing. And
I
I
know you
was.
said it, I'm just telling you what was popping around that room was they don't have to pass that legislation because there's not enough money to do exit 4A in the 10-year highway.
Yeah, I'm not aware of what committee meeting you're talking about. I'll ask some questions and find out and dig it up and certainly try to.
If I may, if I could add to that, any information, right, maybe even the source of the funds too, that might help clarify. That, not just we have the funding, but where the money's coming from, how much, the different sources that might come into play, that might help clarify it.
Exit 4A is going to be done.
Yes. And I would say just.
Are we going to name this thing after you?
No,
Is everyone knowing over here?
There's an awful lot of people that are waiting for this to happen.
Of course.
There is a public informational meeting in Londonderry at the end of this month.
Yes.
Where we'll be reassuring people of the schedule, that it's happening, answer all those questions, so I'll get you this in writing as well too.
Having the schedule is one thing, having the funding is another thing.
At a minimum, I'm going to propose that we name a breakdown line for you. At a minimum, not the whole time. Councilor Stevens.
Mr. Cass, at the end of the fiscal year, when we met in June, I had asked and received a breakdown of what was the proposed amount and where we truly were at with expenditures. And I sent that request out to Commissioner Sheehan. I fully realize that she is out at this time traveling for conferences, and I forwarded it to you. If you could just follow up with your staff and ask if they can update that document of the expenditures made, I would appreciate it.
Certainly, no, I certainly will. I thought when we did the summary, when we did the presentation at Governor and Council in August, I think it was, but I'll definitely get
But
that.
just to update it, thank you.
Sure, certainly.
Councilor Kennedy.
Oh, thank you, Governor. Commissioner, how are you today?
Good day.
So I see back on the agenda are the lease items for Group 11,
Yes.
The various properties. As I understood, there were 54 properties within the state boundaries, and I think something like 43 were under contract to get leases approved with the state with regards to the fixtures on the property. Could you explain to us the meeting that took place and how far along we are with this process? I believe the meeting took place a couple of weeks ago.
Yes. Yeah, at the end of September, and I think it was at one of the last, the council meeting, September 15th, where there was one lease item that we brought forward. We held back a couple other ones that are on the agenda today, as you noticed, in order to have that public information. So we had public information informational meeting. It was both live and virtual. We had about 10 interested property owners involved, and very good discussion. I think we answered their questions. One of the people who was interested in one of those leases is on today's agenda. We are proceeding forward. And I think, there are, the people that, there are a number of, there are a number of ones that don't qualify for leases and stuff, and we've sent out some communications and are working to resolve those. There are another 5 or 6 that we need to, someone needs to do something before they can act, so we're working individually with those property owners, and we're working with the other ones that are eligible leases to get them signed up, so that things is clear and they can proceed with their work.
So would you say we're 50% done out of that 43, or 10%, or 80%?
I would have to check. I'll have to check. I'm not sure.
If you could give us kind of an update on that, that would be very cool from time to time, because the objective is to get all those property owners to enter into some kind of lease agreement. And I assume is that a timeline for that?
Yes, our timeline was actually, we were encouraging people by, it was beginning August, and I think some of these leases are retroactive back to that date, so.
Okay. Yeah, no, I just appreciate
it. And I apologize, I just don't have the count of the numbers. I don't know if it's 50%, but most of the leases, if they haven't come through right here, they are in the works. And like I said, it's probably the 8 to 12 that we are working on resolving, either removals or, like I said, people that something needs to happen. Somebody else needs to do something before they can work. So.
Well, I appreciate you having that public hearing discussion, because all the emails have stopped. I'm not receiving any more emails on the subject, so you're doing something good.
Good. Thank you.
Further discussion on any of these items from the Department of Transportation. Council Wheeler.
Yeah, I just wanted to point out very briefly that 44B is the construction of cashless vehicles, and I already made my arguments earlier, but just wanted to make the point that's what it is, and I'll be against it again.
Thank you. Further discussions on any of these items? I have a question for the Department of Transportation. Mr. Cass, have you ever seen a demolition operator take a building down like you witnessed yesterday?
Never.
A lot of earth-class work. Earth-class work. I had a lot of fun.
Where were you?
Lebanon, knocking out the old railroad. You're going to make it into trails and fields for kids and all that. It was a lot of fun. Thank you for doing that. Dear Lord. I'll get to that too. Don't worry. We're going to knock that one down. We developed that one.
Have experience. Right. Yeah.
Okay. With that, all in favor of items 42 through 44J, please indicate your approval by saying aye.
Aye.
Any opposed?
No on 44.
No on 44B.
2 noes on item 44B. With that, all the items are approved. Thank you. Moving on, I'd ask for a motion to adopt agenda items 44K through 44N from the Governor's Office for Emergency Relief and Recovery. So,
Second.
any discussion? Councilor Kenny.
44L. And I'm not sure if this is a collaborative effort between Commissioner Castle and Commissioner Chevalier. Oh, it's not.
Just me.
Just you. So you know everything about healthcare, okay?
No,
Part of that
I'll do my
last
best.
debate. Okay, how much money is there left with CARES Act money from last year that needs to be spent by the end of this year?
That remains a little bit of an open question as a result of in fact, the item that you have in front of you today is basically sweeping up a number of class lines from projects and programs that have expired. We're reallocating them into a number of last-minute programs, some of which are listed here. The other item that's still out there is the exact number on business recruitment and how much of our recruitment expense program we'll be able to put back into those businesses prior to the deadline. So it's a bit of a moving target, still remains.
Okay, I'm happy to take estimates, but what do you see as being a leftover approximate amount?
It's really hard to say, Counselor. The number that we have here in front of you today is to take $39.5 million roughly and reallocate that among various class lines. Again, taking it from programs that have since expired. It will now be going into a couple of last-minute programs around food security and senior centers, long-term care. You can see the numbers for those there. And then we also have the business recoupment component. So what's outstanding right there is we've been constantly trying to reallocate the funds that originally went into business support of the Main Street program, the SELF program, and the GAP program, back into those same sectors in order to avoid sending any money back to the federal government. And so we're in the final throes of that as we now close off, which we did last week, the business expense program for businesses that still have ongoing COVID expenses. That's a prorated program. So we actually have to see how many people applied for it, how much money we have allocated for it, and then prorate those awards. So until I know the end of all of those calculations, it's really hard for me to give you a specific number. And I'm sorry for the way that sounds, but it's true.
I see a lot of starry eyes out there in the audience, so that's where I get my signals. But so we can't say it's 5 million, 10 million that's going to be left over.
It's empty up there.
It is empty out there, this audience here. But I do see some nice people out there. So my question again is, or I guess I got my answer, we don't know. We don't know what the end amount's going to be, and that's probably going to be pushed off to the unemployment trust fund.
I'd be happy to give regular updates as we go along here with the number as we sort of see it finalizing. We have a deadline, as you know, of December 31st of this year to wrap up the CARES Act funding. Simultaneously, we're also managing a large amount of the ARPA funds as well, which do not have the same deadlines.
Sure. So I'm going to speak about long-term care. Folks are excited that they're getting $11 million. They're excited that maybe there'll be some leftover money and they'll even get more. So I really thank you for bringing that forward to the governor, for supporting that and others. I have a question about the senior centers, who, in essence, have been shut down. They've kind of done Meals on Wheels and other type of programs, while I've been getting through the COVID period, because it's an older population they kind of cater to. What is that money going to be used for if the facilities are, for the most part, shut down and they're only providing Meals on Wheels?
Well, these are continuing an effort to provide COVID-related expense reimbursement for those centers around the state. The number is $4 million here for that under the CARES program. Almost everything under CARES has to be COVID specifically related. And so we have, as you well know, senior centers around the state that have been accumulating these costs over the past year. And we are trying to put some money towards those costs so that they can continue to do what they're doing.
Okay. Can you give me an example of how a senior center would use COVID money?
Sure. I mean, any of the expenses that come with the day-to-day operations during COVID, for the most part, are going to be eligible under this program. We have a very flexible view of what those expenses are, because our goal at the end, again, is to have zero left of the CARES Act to send back to the federal government. So we have a very flexible view of what the COVID expense would be, within federal rules, of course.
Okay.
Then don't break them.
Okay. I think my answer is
Councilor Warmington.
With respect to that same item, for all of these programs, it looks like there's an application process. Can you please produce for the council the deadlines and the links to that application process so that we can get that out to people in our district? And can you tell me how you are publicizing this message to make sure everyone who is eligible is able to apply for those funds?
Of course, once we have all of those program details, I will make a point of getting it around to all of you. You all were very helpful with the non-entitlement units, getting them all signed up as well. I would say, as far as how this is going to go, obviously the deadlines are going to be well in advance of December 31st. How we do the outreach is we've already worked with almost all of these organizations previously under coronavirus relief funds, under CARES Act. We know who they are. They'll get direct communications from us and from our office, alerting them to this program with the deadlines. And we have a pretty standard approach where these are sort of targeted programs, where if we haven't heard from someone, we'll actually reach out to them. So in most cases, we're reaching everybody within the zone of these programs.
Thank you. And with respect to 44K, a similar question. This is money for municipalities. And of course, last time the council was instrumental in making sure that all of our municipalities received the opportunity to apply for funding. And so I would like to make sure that we also receive information about these fundings, the applications, and also who hasn't applied as we approach the deadline so we can make sure that we get the word out.
Yes, ma'am. We will do that for sure. Thank you.
Thank you. Further discussion?
I do have one further question. Can you tell me, I'm getting calls from towns about where we are with respect to the ARPA funds and broadband. I know you've done some hiring in your department. Can you tell me when we might expect to see some funding decisions made there?
Right. So we're moving that program very aggressively right now. We applied for so the initial application to the federal government. We did that within, I think, 48 hours of the eligibility of that application. So we raised our hand effectively. The federal government said we want to have that $122 million for broadband at stake. While we wait for their response, we are designing and talking with communities around the state, understanding exactly what is the status of broadband projects that are underway right now, and being able to start having a conversation about how we can get resources to those quickly and effectively as soon as we get the federal okay to start moving ahead. Simultaneous to that, there are a number of communities that are within the eligible zone that do not have a shovel-ready project at this point. And so we're looking at, again, designing a program that we will have to provide to the federal government for approval to get to those communities as well. Again, this program is really aimed at unserved or underserved areas, last mile type areas, and so that's going to continue to be our focus. But as the governor has said, and as we are acting very aggressively to be among the first to get that money out to our communities.
Thank you.
Councilor Stevens.
A few quick questions here. My constituents are going great guns and hopefully using these funds. They're concerned about what is eligible, and your staff has advised, look at precedent, look what has been approved by the state, for example, stormwater, HVAC systems. Your staff also provided me a guidance document, reporting form, which breaks down 6 categories. Your staff also threw out the idea of hiring, that municipalities should pool their resources and potentially hire an accountant or legal to assist. Would that be covered under administrative fees associated with ARP?
I think that that's all eligible within the fiscal recovery fund, whether it's a state, local, or county.
Okay, thank you.
Councilor Kenny.
Thank you. Back on the broadband topic, obviously representing the rural area of the state, we have county coalitions for broadband, we have New Hampshire Electric Co-op, a lot of other private sector companies want to know where's the coordination when it comes to broadband for the state, who are the go-to people. There's been a little bit concern whether there's enough capacity to take on all these projects, to implement them. And so in your office, because you're wearing 2 hats, over commissioner and also EBE commissioner, how big is your staff that's handling broadband? I know we brought probably some people on and we're trying to build capacity, but who is the point person when it comes to broadband in that section of the department?
So right now we have a 3-person team that's working on the broadband, led by Mark Liberty, who came over from BEA. That, right at this point, is sufficient, I think. We're working with the Gopher team, as well as my broader BEA team in the governor's office, to get that program put together. A lot of it right now is frankly getting the information from the communities that have programs and projects that are underway, finding a way to put them into the mix for the federal funding once we get it. And then also looking at the federal requirements and the federal rules that have been put out to try to design that program for the long term. So those are their two major missions right now. And for right now, that team, I think, is effective.
Will any of that money end up in the broadband trust fund that was created this past session?
Are you referring to the SB 5? Yeah. So that is among the duties that they're looking at right now. We've been in touch with members of the Senate, and we're coming up with draft rules for this, the SB 5 process. The trick is really to try to make these two programs work together as effectively as we can. There are going to be instances where there are different standards. There may be instances where we're able to take some of the funding that is going to be used under SB 5 to supplement the funding that's available under the federal funds. So it's a big mishmash of federal rules and state regulations that we're trying to make all go together. And we've made some pretty significant progress, I should say, to this point. Nothing final to report yet, but it is definitely among the priorities of that.
One thing I would recommend, Commissioner, is to build a map for the whole state and kind of color-code it to what projects are out there or what companies are already providing service and kind of understanding the gaps. Because people talk about telecommunications or broadband. I know the town of Sandwich has their initiative, Grafton County and Bristol has their initiative, Carroll County has their initiative. Everybody's got initiatives, but I can't really see it on a map. It might be good for the council to somehow get a map that's color-coded in different ways to better understand what it is that we're doing with all this money and what broadband initiatives are out there.
Yeah. The map of service areas, the map of the funding, the map of which franchise territory applies to which communities. There's many different maps that we can have and we do have. So we'll get those together as we get this program moving, for sure. And that'll be something readily available.
And you can send that to us in a digital fashion, correct?
Of course.
Thank you.
Further discussion on any of these items from Gopher? Okay, all in favor of items 44K through 44N, please signify by saying aye.
Aye.
Any opposed? Those are approved. I now ask for motion to adopt agenda items 45, 46, and 47 from the Community Development Finance Authority.
So moved.
Any discussion? Seeing none, all in favor signify by saying aye.
Aye.
Any opposed? Those items are approved. I now ask for motion to adopt agenda items 48, 49, and 50 from the Department of Military Affairs and Veteran Services.
Second.
Any discussion? Councilor Stevens, and then I'll come to you.
In regards to the transfer of property in agenda item 48 to Fish and Game, do we have a value on that property?
I can give you a value, but I don't have the value readily handy. Sorry. It makes sense to transfer the property, right? We no longer need it. It's just down the road from Fish and Game, from our Fish and Game facility there in Lancaster, so it's going to work out very perfectly good.
But there is a value has been assigned. Could we see that?
I will get it for you. I don't have it.
Thank you.
Councilor Wheeler, did you have a question? Sorry.
Yes, Governor, on item 50, I was wondering why this is sole source.
This is the contract for the electronic surveillance system. It is the one contractor that is vetted by National Guard to provide those security services.
Is this a new contract or is this an existing provider?
It's an existing provider that we're going back and renewing.
And so you don't think it was fruitful to put it out to bid again? I mean, why is only one security contractor in the whole state able to do this?
That's the one that's directed and approved by National Guard Bureau, sir. We can't not use National Guard Bureau's directed security forces for the military piece.
Is there, so are there other contractors nationally that could potentially do this, or?
I can't answer that. I mean, we didn't go out and look, sir. I mean, I can tell you that. This is the one that the National Guard Bureau directs us to use.
They directly come. Okay. Councilor Kenny, your question?
Thank you, more of a comment, but my understanding is that the Lancaster site, which is going to be managed by Fish Games, more as a storage location, which is great since they are down the road. But on number 49, that the $300,000 kitchen, as I like to call it, is that going to be, can the community access the use of that kitchen, or is it strictly for the National Guard?
So the facility, we have a usage policy so that the community can make a request to use that at any time. And if they want to use the kitchen, they'll be able to use the kitchen.
Sounds good.
Further discussion?
Plan on cooking?
Well, I'm thinking about cooking a cheeseburger if I had it north somewhere.
Well, at the rate we're going, we're all going to be looking for a cheeseburger, but not right over here. Further discussion? Okay, seeing and hearing none, all in favor of 48, 49, and 50, please signify by saying aye. Aye. Any opposed? Those items are approved. I'll now ask for a motion to adopt agenda items 51 and 52 from the Department of Agriculture, Markets, and Foods.
So moved. Second.
Motion and second. Any discussion?
I just have a discussion after we make the vote of the commission.
Okay.
If that's possible.
I want to start making your way up here, Commissioner. Okay, hearing no further discussion, all in favor of items 51 and 52, please signify by saying aye.
Aye.
Any opposed? Commissioner, good morning. Good afternoon.
Good afternoon.
Good evening.
Getting towards the late afternoon.
Commissioner, how are you?
I am well, Counselor. How are you?
You might not be so well after I ask this question.
Oh.
So, I've gotten a few calls the last couple of days.
Oh, haven't we all? And you're talking about the organic certification.
Yeah, the termination of the certification program for organic processor handled livestock operations. And, you know, obviously, I'm going to allow you to kind of tell us where we're at, why the action was taken, and why our 45 organic farmers are upset about it.
Well, first of all, I will apologize for the rollout of the announcement. Unfortunately, I was dealing with some health issues at the time and wasn't paying enough attention to how that was going on. I will also tell you that I wasn't happy as to how I learned about our problems. We had the Director of Regulatory Services leave somewhat abruptly on the way out the door, said, oh, by the way, we really can't do all of these inspections the way we should be. And so with their acting director coming in, I said, I really don't want to end this program to any degree. Please talk to the staff and see what the issues are. So not only did we lose our director who was in charge of that program, which has specific requirements, we're down one full-time staff member there, and the part-time person who was dedicated to organic inspections left also rather abruptly. So the concerns that he was working part-time, still working for the department, but in another capacity. And so the issue there was that we were concerned when it came to the processes in the animal industry. We really could not do it according to how the USDA is requiring us to do it with the staff. We're still doing 81 farms that do fruits, vegetables, hay, and maple. So it was about a little over a third of the inspections were dropped. This program has been in place for over 30 years. There's never been an increase in the fee we charge. We're about 3.5 times less in terms of what we're charging as others. We're private certifiers. And in fact, we're turning away people. So that creates a whole problem. Because personally, I don't think government should be in business of providing the service for some people, those who got in the door early, in saying, anybody else, tough luck here, you can't get the same benefit. So we're in the process of evaluating, and I have kept the governor's office apprised of what we're doing. We are working on a proposal to do all of the certifications again and what that would look like, so that the legislature can put that in place if they want. My recommendation is we ought to be doing all or nothing, but we were in a catch-22 where we couldn't possibly continue to do what we were doing. And so while probably should have finessed that a little bit more as we rolled that out, and I've been dealing with the aftermath of that as others have as well. That's essentially what happened and where we're at.
So could you possibly at the next Governor Council meeting just give an update on your progress on this new plan and the direction? Because I know that is the big issue in this next government.
We expect to have that done, and we'll be glad to provide you with an update, because it needs to come in on the Senate side, and their final period will be closing, so we do need to get that done. So should have that for you by the next meeting.
Okay, thank you.
You're welcome.
Further discussion? Oh, sorry. I guess we have to vote on that. I apologize. I now ask for a motion to adopt agenda item 53 from the Office of Professional Licensure and Certification.
So moved. Second.
Any discussion? Councilor Warmington. Good afternoon.
Sorry, Governor, it's heading in the back. Good afternoon, Lindsay Courtney, Executive Director of PLC.
Well, Director Courtney, I'm just following up on our conversation regarding the backlog of background checks, which are delaying healthcare workers from starting work. Can you tell me the extent of the backlog at this point?
So what I can say is that we are utilizing every tool we have to help get people licensed pending the background checks. The office instituted or promulgated an emergency rule to allow us to bring back retired healthcare workers that don't have a criminal background check or criminal history record check requirement, as well as student nurses. In terms of the numbers, I think that it's impacting nursing probably the most. The last time we checked, we had 1,100 nursing and nursing assistant applications pending, with about 900 or so of those still needing a criminal history check. That said, that data doesn't tell us whether they're actually practicing on a temporary license. I feel very confident that a sizable portion of those are able to work. It's really those individuals that are coming right out of education programs that I think are experiencing the delay. We have been working, and I know you have an agenda item before you, I think it's 81, with Department of Safety, and they're on it, their people are great, and I'm sure Commissioner Quinn can talk about that, but I fully anticipate that working together, this issue will be resolved shortly.
Yeah, I think the last time that we talked about this, about a month ago, the backlog was 1,100, so I'm a little disappointed to hear that it's 1,100 today. I'm sure that more are being added to the list all the time, but it doesn't seem like we're making headway here in getting that list down to 0, which is really, where we want to be.
Well, I don't think the list will ever be down to 0, because that just speaks to the number of applications we have. The large majority of individuals don't apply with all of the completed information. So we will always have, hundreds of applications that are missing something, and my staff spend the bulk of their work reaching out. What I can say with certainty is that all of those applications have been touched, meaning that my staff have looked at them, contacted people to let them know what they're missing, and sometimes it's things outside of their control, like the criminal history check, although they need to go and get the live scan done. Other times it's within their control, like if they didn't submit their references or things that they needed to submit. So I do feel confident that individuals have been told what they need to receive the license. And then there's that additional licensing piece where most of them are eligible for temporary licenses and probably are working.
I think Commissioner Quinn has come up and stood behind you. Maybe he wants to add to this.
Yeah, just to add one thing, I'm very pleased with the attention that the colonels and his team are placing on this. And I will tell you that now the delay on the state check only is down to 13 days. We're 8 days on a fingerprint background turnaround, and it takes 9 days to get in to get the fingerprint. So they're monitoring this daily. Assistant Commissioner Edwards is working with the state police team, and I think as the portal gets more robust with all the state agencies, we're getting ready to roll out the public facing on the state check only. That should be going here shortly, so I think that we're going to see significant improvements. And I'll just add to that, when we have had mission critical backgrounds that need to be done, we're putting those to the top of the list and turning those around every day.
Thank you.
Councilor, I would just echo what Commissioner Quinn has said, that the agencies are working hand in hand when we have those critical issues, and safety has been wonderful to work with us. And I feel confident between the two of us that we'll get it done.
Thank you.
Further discussion for the director? Thank you. All in favor of item 53, please signify by saying aye. Aye. Any opposed? The item is approved. Now is the motion to adopt agenda items 54 and 54A from the State Treasurer.
So moved.
Any discussion? Hearing none, all in favor signify by saying aye. Aye. Any opposed? Those items are approved. Now is the motion to adopt agenda item 54B from the Department of Revenue Administration.
So moved. Second.
Any discussion? Okay, hearing none, all in favor of item 54B, please signify by saying aye. Aye. Any opposed? Items are approved. The item is approved. Now is for motion to adopt agenda item 55 from the New Hampshire Employment Security.
So moved. Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? That item is approved. I now ask for motion to adopt agenda item 56 from the Department of Corrections.
So moved. Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Good to see you, Commissioner, again. You're going to be here for a while. You got the job. You asked for it. Congratulations. Keep up the good work. I now ask for a motion to adopt agenda item 57 from the New Hampshire Liquor Commission.
So moved.
Any discussion? Oh, Councilor Stevens. Someone from Liquor here? Commissioner Malika? Or the whole team. Here we go. I noticed Mr. Armaginian is hiding in the background. He can tell that unless he's called.
He's too big to hide.
There you go. Okay, Councilor Stevens, go forward ahead.
So this contract is for e-commerce, enhancement, maintenance, and support, B2B, B2C, and enforcement. My question is, how did we ever settle upon a vendor that's out of the United States?
Excellent question, Councilor. For the record, Joe Malika, Chairman of the New Hampshire Liquor Commission, continuing our Deputy Commissioner Nicole Broussard, and April Bunker, who's our Program Manager. The original contract came before Governor Council, and Avinica was a piece of that contract. And so Avinica actually worked for Alpha People. And then when the contract with Alpha People was no longer valid, and we removed them from their duties, we came back to Governor Council and approved that segment of the contract where Avinica was a subcontractor for Alpha People.
Thank you.
You're welcome.
Councilor Kenny.
Interrupted, Commissioner. What's the status on the area agency agreement process in Pittsburgh? We're in the final, we've had 3 applications, and we're in the final improvement phase where we're going through and looking at those applications. We're at the final piece. We had 3 applications for that license. Thank you. You're welcome.
Further discussion? Seeing none, all in favor of item 57, please signify by saying aye.
Aye.
Any opposed? Item 57 is approved.
Thank you very much. Have a great day. You know where the margaritas are.
What's that?
You know where the margaritas are.
Trust me. Trust me, we have a map. pre-programmed into Google, ready to go. I now ask for motion to adopt agenda items 58 and 59 from the Department of Business and Economic Affairs. Any questions? Seeing none, all in favor signify by saying aye.
Aye.
Any opposed? Those items are approved. I now ask for motion to adopt agenda items 60 through 63B from the Department of Natural and Cultural Resources.
So moved.
Second.
Any discussion?
A question on 63B.
I think the Commissioner's here.
I think this is somewhat of a unique contract.
Why do we have communications with contractors seeking service out of Washington, D.C. on the top of our Mount Washington? Washington hasn't been president for a while.
Thank you for the question. The top of Mount Washington, being the highest mountain peak in the east, the northeast, is a critical communications location, and we have been supporting specific communications for public safety at the top of the mountain for a while now, and so this is a continuation of our contract with the officer.
Okay. Are we expecting a president from New Hampshire soon?
Sure.
Okay.
Just give me a couple of years.
All right, thank you, Commissioner.
Any further questions? Okay. All in favor of items 60 through 63B, please signify by saying aye.
Aye.
Any opposed? The items are approved. I now ask for motion to adopt agenda items 64 through 72O from the Department of Environmental Services.
Second.
Any discussion? I'll give everyone a minute. It's a lot here. Okay. All in favor of these items, please signify by saying aye.
Aye.
Any opposed? These items are approved. Sure. I think Councilor Seekers might have one minor post-vote question.
Good afternoon, Governor and Councilors. Bob Scott with the Department of Environmental Services, and Councilor Stevens, I welcome your question.
When speaking before the Southern New Hampshire chapter of the New Hampshire Home Builders Association, the discussion turned to permitting, AOT and wetland permitting, primarily AOT. And seeing within ARP funding what was initially $500,000 is now $722,000. Where do we stand with getting the permitting or getting the staff up and running?
So we're working very closely with the Fish and Game Department, Scott Reclamation and his team. I believe right now they've hired a new, I'll back up a little bit for everybody's application. So to the extent that the delay of late has been regarding threatened endangered species, I think that's probably what you're talking about, Counselor. If not, please tell me, because I don't want to go off on a tangent that's not appropriate. We've been able to move with ARPA funding. We want to make sure that ARPA projects, that the water and wastewater projects don't get delayed, so we moved some money for that. And they've hired positions over there, and they have, I believe, 400 positions they're in active recruitment for. That'll go a long way in helping that. And also with that, and both the Department of Environmental Services and the Fish and Game Department now have rulemaking that's underway. We've already received public comments on that will streamline that process considerably. I think there might have been there's been frustration with everybody involved, I believe, but I do think there's a good solution in place that will take effect pretty quickly. There was those rules in effect, and Fish and Game has those staff trained.
I appreciate it. One of the builders had a 40-unit subdivision ready to go, and permitting was delaying. And he was also having to maintain his work crew. So again, I appreciate it.
Thank you. And we did vote on these items, so I think Thank you, Commissioner. I'm going to move on to a motion for item 72P from the Connecticut River Valley Resource Commission.
So moved.
Any discussion? Seeing none, all in favor signify by saying aye.
Aye.
Any opposed? Yes, item 72P is approved. Could I get a motion to adopt agenda items 73 and 74 from the New Hampshire Veterans Home?
So moved.
Second?
Any discussion? Seeing none, all in favor signify by saying aye.
Aye.
Any opposed? Those items are approved. I now ask for a motion to adopt agenda item 75 from the New Hampshire Lottery Commission. Any discussion? Seeing none, all in favor signify by saying aye.
Aye.
Any opposed? Item 75 is approved. I now ask for a motion to adopt agenda items 76 through 80 from the Department of Education. Is there a second? We have a motion and an enthusiastic second. I know it's getting late. I appreciate everyone's stamina here. We do have a question from Councilor Kenny for the Commissioner.
Contract at 79. So, good afternoon, Commissioner. How are you?
I'm well. Thank you for the record. Thank you, Commissioner of Education.
So this is money to be used towards I guess, for teachers for their training and certified in education finance from Georgetown University. Have the Jumpstart people that do financial literacy here in New Hampshire know about this, and was there any interplay between both groups?
Yeah, so Jumpstart is actually kind of a different offering that you would have. This offering is actually for school administrators to up their skills in school financial management. And so it's really a different product than Jumpstart, which is really a curriculum relative to students and personal financial capability.
So what type of people would go to get this type of training certification within the school administration?
So we're offering this to superintendents, to business administrators, to principals and assistant superintendents, anyone who would work with the administration of funds in the school to try to up that skill level.
Okay. So these are people that didn't go to math class?
I don't know what classes they took.
Okay. All right, then. Thank you.
Thank you.
Councilor Stevens.
Commissioner, in regards to agenda item 80, the sole change to this, the transaction fees were going to be assumed by the Department of Education versus the camp itself. Is that correct?
That's correct. And so we basically just clarified that in the contract because there was some question about that. So before we went forward, we wanted to ensure that that was clear to everybody how that was being paid.
Additionally, I sent you an interesting article regarding charter schools for ASNs, for nurses, which are popping up in New York and Rhode Island. Can we start that dialogue?
We can absolutely start that dialogue. I actually took a look at the program that you sent over to us, and it's very similar to our Career Academy, our New Hampshire Career Academy program, so that our students in the secondary system can easily transition, particularly into some of those medical fields, and attain those post-secondary credentials.
Thank you.
Additional discussion for the Commissioner? Councilor Warmington.
Commissioner, on item 79, you note that that item was originally approved by the governor on April 23rd, earlier this year. But you don't note that that was ever presented to the council as an informational item or otherwise. Was it? That's my first question.
I would have to check, but it's...
We could take a look at it. There was every assumption that it would have come to you as an informational item at some point.
I don't believe it was, but
Okay.
I would like to hear that. And do you know whether you have other contracts that were approved by the governor but never brought to the council?
I don't believe so, but we'll go back and we'll do a full reconciliation to make sure that nothing was omitted from being presented to the governing council.
Okay, appreciate that. I have been contacted about this item in particular with people wondering how they apply. Some school districts telling me they've never heard of this and how our educational leaders are selected.
So it's open to all of our educational leaders, so we're not limiting who is able to participate in it. You'll notice that this extension is really a time extension because we initially tried to offer it to our educators really going back into the springtime. The objective was we have received an inordinate amount of funding to our schools, federal funds, over $650 million. And so we want to make sure that our educational leaders are equipped with the skills to be able to manage such large amounts of monies. And so we offered this training to them. Truthfully, the schedules for these leaders during the springtime was so rigorous that they did not have time to participate. We still think that there's a benefit. We've still heard from superintendents that it's a benefit to their administrators to be able to participate in this training, so we're extending the time to be able to offer that to them.
Okay, thank you.
Further discussion for the commission? No? Okay. All in favor of items excuse me, 76 through 80, please signify by saying aye.
Aye.
Any opposed? With that, those items are approved. I'm going to now ask for a motion to adopt agenda items 81 through 86E from the Department of Safety.
Second.
Any discussion? Councilor Stevens.
Good afternoon, Governor and council members. For the record, Bob Quinn from the Department of Safety.
Commissioner, in regards to 86B, the funding source, it's noted that 40% of this contract is privately funded. Could you discuss that briefly?
I'm going to ask Steve Lloyd to jump up with me, please.
Good afternoon, Governor. Councilor Steve Boyd, Director of Administration. The private source funding are funds received from Seabrook Station. There's an assessment to support both radiological response and also Homeland Security as a whole. And this is funded out of the Homeland Security Division, and that's what that funding is made up of.
So it's essentially coming from a fee.
In essence, yes.
Thank you.
Any further discussion? Questions for the Commission? Hearing none, all in favor of items 81 through 86E, please signify by saying aye.
Aye.
Any opposed? Those items are approved. I now ask for a motion to adopt agenda items 87 through 92D from the Department of Justice. And please note that 92C is not being used.
So moved.
Second.
There's a motion and a second. Any discussion for the Attorney General? Seeing none, all in favor of these items, please signify by saying aye.
Aye.
Any opposed? Those items are approved. I now ask for a motion to adopt agenda items 93 through 107 from the Department of Administrative Services.
So moved. Second.
The motion is second. Any questions for the Commissioner and his team from the Department of Administrative Services? Councilor Kenny.
Thank you, Governor. Commissioner Allenhouse has a question on, a few questions on 107.
107.
The last one.
Yes.
Charlie Allenhouse, I'm the Commissioner of Administrative Services. Good afternoon, Commissioner. So I've had a lot of questions that have come out of Laconia with regards to this, but so I just want to ask at least 3, 4, 5. The first is, when it comes to this brokerage real estate contract, what are the criteria that have been set down within the contract?
For what?
Selling the property.
You want to know what the commission is, or the criteria? There's no criteria for selling the property. We're going to take the best deal.
Okay.
I mean, is that what you mean? I'm sorry, I don't mean to be smart aleck.
Yeah, my question.
Okay. The commission is they're guaranteed $50,000, and then if the selling price isn't a good net price, they're guaranteed no less than another $50,000 or 5% of the cost. So it's a 5% commission, but they're guaranteed $100,000
Plus 50,000.
I think 50 plus 50.
So my next question is, Has this particular brokerage firm worked with historical properties before?
Worked with this property?
Worked with historical properties before?
Yeah, I think this is one of the largest brokerage firms in the country. I think they work with all kinds of properties of all sorts.
Okay, but when you were selecting them, did you know that they specifically have worked with historical resource properties in the past?
You know what, I don't know directly that that's what the team went into and asked them that question specifically. I do know that the selection team, which is in your packet, it's Jared, who's our real estate lawyer, is very good. And obviously he's done a lot of work not just on this property, but a lot of state properties. But also Sarah Langberg, who's the head of court facilities, who a lot of you know anyway. And then Tom Kerr. And they understand that that's a big deal, and that the relationship with the Division of Historical Resources, even though they're removed from the process technically this time and that sort of property, the group was picked for their, in part for their experience in properties like this, complicated properties with a lot of different aspects to it. I don't know that anybody said specifically historical, right? But they do have historical property experience.
Okay. My next question is, has your office, with regards to this brokerage contract selection, worked with the city of Laconia at all?
Not with regard to the selection. The selection of the brokerage, we put out an RFP. We received responses to the RFP. I could look, but I think it's 4 responses that we got to the RFP. We selected a team. The team, if you think about who we selected, is a fairly obvious team to pick for something like this. They met and reviewed the contracts, but we did not do it in conjunction with the city. But obviously, in terms of a sale of a property, the city of Laconia will absolutely have to be involved just because of all of the interlocking things that come into play.
Okay. Okay, that's all the questions I have.
Any further discussion on any of these items?
Yes.
Councilwoman.
On the same item 107, are there conditions that are placed on the sale of that property?
There are not. There was a language placed in House Bill 2 this year, language passed in House Bill 2 this year, that basically leaves the only condition on the sale of the property is governor and council approval.
And so, is there a condition on the property that the buyer would have to provide an access road to Ahern State Park, which currently goes through this property?
There is, with this property, there are lots and lots and lots of things that are related to it. One of which is the presence on the site of a couple of units, E911 and Lake Region Mutual Aid. One of which is Ahern State Park, and then there are various other things, including some historical things. There's not any legal. I don't think there's anything in the law about the sale of the property about access to Ahern State Park, but they do have to have access to Ahern State Park. And whether that, we'll work with parks to, right now it's across the, if you think of the property at the end has one of these. It's sort of like a V with the info. And I think right now, I don't have a map in front of me, so don't hold me to this, but it's that dirt road goes across there. What I hope happens is that instead we just have to go straight to the highway, and that they not have to go onto our property and then over to Ahern State Park. If we sold the property without them instead just constructing direct access, we would insist that there be, don't ask me to get technical, an easement, I think is what we would call it. But yes.
And so there is currently no condition on the property that it honor any leases that the state currently has with the city of Laconia?
No, the language in House Bill 2 is that the only condition on the sale of the property is governor and council approval. So I say that just to say that if you're asking if there are legal restrictions, if we have leases, we have to honor them. And so, that is a restriction. It's just not a restriction on the sale of the property.
So if I may, again, I think what Commissioner Arlinghouse is correctly referring to is the council has the ultimate say in whether this property gets sold. So any conditions that the council would like to see or anything like that, that's the empowerment of this body in terms of ensuring that any and all conditions required or asked of by the city or the state or the town, that's this body's responsibility, and we can do it almost any way we want.
Can I add, given how complicated this piece of property is, and the stuff both above and below ground, some of which we know, some of which we know that we don't know but expect, I wouldn't expect you to imagine seeing this on a Friday and voting on it on a Wednesday when we finally have a deal. You'll hear about the deal, we'll tell you it's coming, there'll be all sorts of negotiations involved. Whoever buys it, the level of due diligence will take years, not a week and a half.
Yeah, and this contract did just come to us on Friday. It wasn't one carried over from a prior meeting, and all of the councilors may or may not know you received an email last night at 10:30 from the city mayor and council from Laconia. I don't know, our inboxes are so full, you may not have all seen it, but I know Councilor Kenny and I have both seen it, with the council expressing concerns about the needing to be involved in this process, and I do support that, and for that reason I would like to table this contract until the next meeting.
I think the governor brings up a really good point, which is it's really the governor council that's going to make the decision. And so there's a 2-year window with this contract. I think we have ample time, but out of respect to just maybe the Lakeshore Redevelopment Planning Commission in the city of Laconia, to give them time to look at this and just, from their standpoint, exhale and come back to the next council meeting and vote on it. So I will make a motion to table.
So there's a motion and a second to table. All in favor of tabling item 107, please signify by saying aye.
Aye.
Any opposed? Item 107 is tabled. Any other questions on any of the other EAS items? Okay, hearing none. Councilor?
Can we get an explanation of the $100 million you're spending?
You can if you don't follow the $100 million I'm spending. I know the item you're referring to. There are 10 Salesforce contracts before the council. Salesforce is a piece of software that the state uses. It's a customer relationship management software. It's a common national, I think it's a national firm, and I have no idea where they're headquartered, but the way the state works on software contracts, for example, agencies will routinely have a one-off thing that they have. They buy something and they measure milk production rates. And only one agency manages milk production rates, so there's a single piece of software. As multiple agencies purchase similar amounts of software, DOIT gets involved. We do contracting for DOT, but DOIT gets involved as well. It's the same with purchasing, right? If 10 different people are buying the same stuff, we do a statewide contract for that. This is the equivalent of that for the multiple agencies that are starting to use Salesforce for multiple things. How is this contract constructed? DOIT has made a determination that Salesforce is in part based on what people are doing with it and how pleased they are with it, and in part based on what they know about markets and are you in Gartner's Magic Quadrant and all that kind of computery stuff. They decide to go forward with it. This method of procuring professional service agreements or implementation agreements for utilizing Salesforce within an agency is that we have master agreements with 10 separate vendors. There is an aggregate total across all 10 vendors of $10 million. It's not 10 times 10. It's $10 million across the bunch. If we contract with somebody and they spend 9.2 and somebody else has spent 700 grand, we got 100 grand left for everybody else. It's when we hit 10, we're done. Everybody's done. And so it's 10 in the aggregate across all the contracts. What you're meant to do, it's a master agreement. So we have a contracting relationship with the entity, so that we're not redoing this part of the contracting every single time. You develop a statement of work, you market it to multiple agencies, multiple approved vendors, you pick that one. That agreement then, though, that contract, that sort of subcontract, if you will, that you're going forward with one of these 10 companies, will then come to council. If you look at the items, there's a provision in the explanation that says that. This is because at one point, I think I can say this, the governor said to me, is this just a clever way to avoid going to council? And I said, well, not if everybody has to come back to council. And he said, maybe we should put that in the agreement, and so it is. And so every agreement over $10,000, the current limit of in Mach 150, will have to come back to council. In addition to that, I should say, just because I am aware of some of the bloggy things that have been said about this, I think people should know that you can't spend money that you don't have appropriated anyway. This is not an appropriation.
Further questions? Okay, seeing no further discussion, all in favor of items 93 through 106, please signify by saying aye.
Aye.
Any opposed? It is approved. Is there interest in taking the table item from DAS off the table? Table item 89.
Yes.
So there's a motion and a second to take, all in favor of taking item 89 off the table, please signify by saying aye.
Aye.
Any opposed? Item 89 has been moved from the table. Can I get a motion to adopt agenda item 89?
Motion.
Second.
There's a motion and a second. Any discussion on item 89? Councilor Kenny.
I just have just one question, Commissioner. This was tabled, I don't know how long ago, but can you explain to us what the cost savings are? Because I'm still a little bit perplexed on.
No, it's a good question, and I'm going to background for some people who don't remember, haven't been following, or didn't care the first time. The state procured prescription drug services this year for reverse auction. There are some lobbyists for a particular form of reverse auction floating about in the ether out there, who have suggested that because of all the states that have done this before, that saved a lot of money doing it, that we will, I'm going to, by the way, just put the words save in quotes on your binder, if you will, that we are going to save a lot of money as well. It's important for you to know that of all the other states that have done this, the list of those is New Jersey. Oh wait, that's it. So the list of all the other states that have done this in the past is New Jersey. And so New Jersey is a wonderful state. They have glorious beaches that I go to every year. My wife is from New Jersey. I thank them for that. Their government is not one to model. They didn't save money with reverse auction in that way. And the other thing that they didn't do in the past was bid. They didn't used to bid stuff, and they didn't used to manage their contract. We bid stuff and we manage our contract. And so how do you calculate savings? So we're spending, I have two answers to this question. We're spending a little bit more money than we spent on the last contract, but we saved $20 million. How is that possible? Depends on how you count savings. There are presentations they've done to national trade organizations alleging that because they thought they were going to spend $8 billion and they spent $6.6 billion, that they saved $1.4 million, which is a little goofy. So what did we do? We bid. We did a reverse auction. We did 3 rounds of bidding in a reverse auction. We used a fairly complicated, because the legislation on this was very prescribed. We used a fairly complicated method. We actually had to hire by law, had to hire a company. The company was called SkySail this time. To do that, we did 3 rounds of bidding. We picked a company. We then go back and negotiate with the company who wins the 3rd round, and we have a number. We then ask, we have a consultant that does a lot of advice for us on healthcare matters, Siegel Consulting. The council has spoken to them on numerous occasions. Typically has liked them. I don't want to say that applies to all 5 of you, or that all of you have spoken to them in the past, but historically they like them because they're smart, which is why we like them too. They then look at the data and say, if you had done nothing, based on utilization last year, what would your costs be? And based on the new contract, what are your costs? The difference in those 2 costs was about $19.5 million. So you could say we saved $19.5 million. I would tell you that our costs are going up just a little tiny bit. And I would point out, for people who really want to know, our percentage savings change on the commercial lines is slightly less, on the egg whip lines is slightly higher.
So I just want to follow up. So the answer to my question is $20 million, that's the savings.
If you accept the methodology I just described, yes, it's 19.4.
And if you don't accept the methodology, it's $1 million in savings.
If you don't accept the methodology, it's Joyce, are we spending $8 million more? $8 million more than last contract, yes.
Okay. Thank you.
Councilor Stevens?
Commissioner, this vendor has had their share of lawsuits. In 17, they were at risk with losing Anthem. 2020, the Ohio Attorney General sued this provider. They were overcharging their state troopers. And then lastly, most recently, the Louisiana Independent Pharmacy Association has sued based on unlawfully passing fees onto these smaller pharmacies, fees that they were supposed to absorb. Has anyone looked into this further?
So we manage our vendor, and every time there's a lawsuit, we look into it, and we talk to people about it. All the Ohio lawsuits, for example, it happens to be that our Siegel pharmacy guy is based out of Ohio, and we did look into them, and we look at how people manage contracts and what may or may not be true in those contracts. This is true of every vendor that we have in every space, certainly in insurance. There are some differences between the way other states do this and the way we do this. And one of them, most notably, is that we audit every claim every year. We don't audit representative samples occasionally, every 5 or 10 years. We audit every claim every year. And we are on top of our vendor. When there are problems that we hear about, we come up, we can listen to customer service tapes, and we manage everything. So yeah, we are aware of problems. We look into them. We are very confident that the state is not having problems. The state is not getting overcharged. And we know that because we audit every claim every year. And I say that, and it sounds like I'm being silly, but it's a really, really, really big thing that a lot of states don't waste their time doing. And that we do, quote unquote, waste our time doing. It's not cheap. It's not easy. It takes time. But it's really important to provide assurances to the taxpayers that we're not floating the money up into the trees.
And is it a necessity that you have to do this, or are you electing?
I don't believe there's any law that requires us to audit every claim every year, so we are electing to do that. But we think it's good management. The way the state works, and I think people know this, that until about 20 years ago, 2003, 2004, we just bought an insurance policy. And we didn't manage an insurance policy, really. We just bought an insurance policy. And we did, we contracted with whoever, Anthem, Cigna, Health Source, whoever it was back then. And we went to self-insured in 2003. The growth of that management over the last 2 decades has been extraordinary. So we're managing. I think we separated the contracts in something like 2006, 2005, I was close. In 2005, we separated medical and prescription drugs. The person I keep asking is Joyce Hedman, who's our director of risk and benefits, so Joyce can wave to the crowd. We did a lot of stuff with Health Trust for a long time, but we went our own way in 2016. And what we have is we have a staff, and it's grown over the years, but we have a staff in risk and benefits that is very, very, very competent. In 2013-ish, Cassie Keene came up, who was also back there, from the Attorney General's office, and she'd been at HHS. She was at one point Director of Government Health, and she happens to be quite competent, which was a good thing for us. She brought with her Joyce, who's now the Director of Risk and Benefits herself, and we manage. We manage aggressively, constantly, and continually. And that's why we don't have problems, and why I say it was easy for New Jersey to save a lot of money because they were pathetic, and we are not.
Thank you for the explanation.
Councilor Wilmington?
Yes, thank you for you and Joyce and the time that you spent with me explaining what's going on with this contract. I have 2 more questions for you. Real-time audit function is part of the new statute, and will this contract be requiring that? Will you be doing the real-time audit function?
Yes, it's required by law. We do everything required by law.
Okay. And will you release the data from the earlier reverse auction rounds identified?
We will. We talked about this. We will release the data from the earlier rounds. There's a process we have to go through first. We've consulted with the Attorney General's office on this. And that is to say, so you have in your packet round 3, and I thought we could release rounds 1 and 2 as well, because of the nature of the RFP. I think we'll write it differently next time, and whatever legal prohibitions on this exist, we're going to get rid of them. But we have to tell the vendors that we're going to release rounds 1 and 2 before we can release rounds 1 and 2. So upon approval of the contract, we will tell the vendors we are going to release rounds 1 and 2 as well. I don't personally understand how it hurts anything to release rounds 1 and 2, but we are advised by people who went to law school that we can't do that without asking them or telling them first.
Okay, but you will do that?
We will do that immediately.
Okay, thank you.
Any further discussion on this item? Seeing none, all in favor of item 89 as previously stated, please signify by saying aye.
Aye.
Any opposed? Item 89 is approved. With that concludes our regular and table item agenda. If there's nothing else to come before the council, the meeting is adjourned.